Thank you so much, Dr. Quinn, for talking with us. Well, Dr. Quinn, tell us the latest on the coronavirus here in Hinds County.
Well, according to the Mississippi State Department of Health, as of 6 p.m. yesterday, we have 550 new cases, 6 new deaths, and 87 outbreaks in long-term care facilities. I mean, this is very, very troubling because, number one, I mean, we're continuing to get cases, and what really scares me more than anything is the increased cases in the long-term care facilities. I mean, these are our most vulnerable individuals in our population, and this is the most common individual who can possibly lose their lives.
Dr. Quinn, what are we doing wrong? You know, we know how to prevent this thing. Or is this just a stronger outbreak, or are we just being sloppy?
Well, I mean, the problem is, I mean, people are starting to get impatient. People are starting to resume normal life, and we cannot do that. I cannot overemphasize how important it is that we continue to put this information out and let people know that we are not out of the storm. The number one tool that we have is social distancing, and it's shown to be very effective in a lot of other countries around the world. But here in America, we're having a problem doing it, and I'm very fearful of this coming up weekend with the 4th of July. You know, this is a very celebratory weekend. People get together, they barbecue, they have a great time. This is not the time because, as I said before, we had just 6 new deaths as of 6 p.m. yesterday. People are losing their lives, and we've got to take this thing seriously.
As a member of the coronavirus task force here in Jackson, are you guys looking at any measures, new measures to be put in place?
Yes, I mean, the leadership of Jackson is doing an excellent job. Mayor Lamamba and the rest of our task force, we're meeting every Tuesday. We're coming up with new ways to help our city. And I must give kudos to us here in Jackson, Mississippi, because we do actually have a pretty good number as far as individuals who've lost their lives and who've contracted the COVID-19 infection. So Jackson is actually doing a pretty good job, and it's so ironic because in some of the surrounding cities, they've laxed irregularities even more, but in Jackson, they're pretty strict about wearing masks. I had one guy in a gym in Ridgeland tell me that he worked out in Jackson, and they made him wear a mask while he exercised, and he was angry about it, but I said, hey, the mayor of Jackson and the rest of the leadership, they're just trying to save your life, and they're actually doing a pretty good job.
Mm-hmm. Is that something we need to, should we come back in with more restrictions, or should we just, you know, be grown up about this thing and do what we need to do? What's your recommendation on that?
I mean, the bottom line is, I really feel that we do need to put more restrictions in, because honestly, it would be great if everybody just maintained the personal responsibility, the social responsibility of social distancing, wearing masks. But I think this is a time when leadership has to step in and just put more, put more restrictions on the population, because at the end of the day, we've got to slow this thing down, because I can't just speak enough about how many lives are being lost. I mean, we lost the first life back in March the 19th of this year, and since then we've had over 1,000 people to lose their life here in the state of Mississippi. I mean, this is something that can't be overemphasized, and I really emphasize that we need our leadership to just put those restrictions in, and it's going to be unpopular. But sometimes when you make hard decisions, you can't worry about popularity. You have to worry about safety.
And again, I know some people just won't wear masks. Tell us, are they effective? How effective are masks?
I mean, one of the #1 reasons why this virus is so effective is the asymptomatic carriers and the pre-symptomatic carriers. These are individuals who contracted COVID-19 and maybe they don't have the typical symptoms. They don't have the fever, they don't have the cough, they don't feel sick. But the problem is they're going around in the population, and you can spread it through respiratory droplets by sneezing, coughing, or even just talking. So if we could get everybody to wear a mask, those individuals that are asymptomatic, well, there'll be a barrier between them and somebody that's vulnerable that does not have the infection. And if they talk to people, then there's less of a chance that they'll transmit this virus to someone. And that will definitely slow down the progression of this spread. I mean, I can't overemphasize it. Everyone should wear a mask when out in public. If not for themselves, we have to think about other people, especially the vulnerable population who are the elderly and those with chronic medical conditions who have compromised immune systems. We just have to do it. And I just pray that we'll continue to get that information out and our leadership will add more